name is not restricted to only those who are tennis players, but it is a common condition or a common problem that can affect anybody, especially those busy executive moms who are spending extensive hours working on their laptops. And this repetitive movements when you are typing or when you're moving your mouse and you're using the computer, this repetitive action of your wrist and forearm can lead to this problem called tennis elbow. So, in today's video, we will discuss the basics of tennis elbow, what exactly is tennis elbow, what are the common symptoms, and what are the causes of tennis elbow. Now, I will talk about all of this in relation to people who are using their laptops or typing for prolonged periods of time every day. So, basically, for busy executive moms. Now, tennis elbow also it's also known as lateral epicondylitis. That is the medical term because, as I said, tennis elbow does not just affect tennis players. Now, it is an inflammation which is also known as a tendinopathy, but it is an inflammation of the tendons that are attached to the outer elbow. So, if this is your elbow, this is the outer bony area of your elbow, and when the tendons, that is the muscles, they attach to the bone by these ropey strings of muscle, those are known as the tendons. When there's an inflammation in the tendon in that outer elbow area, that is known as a tennis elbow. Of course, it can lead to a lot of pain and discomfort. It's not just a simple condition. However, this is the basic understanding behind the concept of tennis elbow. Now, before we get into the topic for today, further into the topic for today, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. I help moms of younger kids who work in high stress executive jobs to manage their spinal, that is back and neck, nerve, and joint pain. And I do all of this by giving you simple exercises, easy lifestyle modifications, some simple tips and tricks that have helped me in my own pain journey. And I do all of this without taking away a big chunk of your time because, hey, we're moms, we're busy people, right? So, going back to tennis elbow, let's understand tennis elbow, its causes and symptoms. Now, usually for executive moms, that is moms of younger kids who are working in executive roles, the cause of tennis elbow often lies in the repetitive strain that is caused on this tendon during activities like typing and using the mouse, as I said. Now, when you are using these when you're using your wrist in the repetitive movement for a certain amount of time, it's still okay, but prolonged hours that are spent doing this repetitive action, when you're typing and your wrist is not in a neutral position but is sitting like this, or when you're holding the mouse and your wrist is like this, when these repetitive actions happen over a prolonged period of time without adequate rest, sorry, and this poor posture can lead to inflammation along the tendon. And you might think, what's got the wrist got to do with the elbow? Now, the tendon that is attached to the outer elbow is basically coming down and it crosses the wrist and it's attached to your fingers. So whatever is happening at this end is going to affect the other end as well. So that is the that is how tennis elbow happens when you are using your wrist in a repetitive movement in a poor posture over a long period of time. Now, of course, there are other factors as well, such as in when you are at home. You are, say, picking up your kids, your wrist is always in that bent position, you're not keeping it neutral. Or it could be something as simple as you happen to bang your elbow against the wall or the door, and then you got that inflammation in the area. So there can be a number of other reasons, but these are the most common ones. Now, what are some of the symptoms that may indicate that you have a tennis elbow problem? So the very first thing is there can be burning or even pain or even burning sensation in that outer part of the elbow. This area is known as the lateral epicondyle. So when there is a pain or discomfort or a pulling kind of pain or a burning pain, these can all be indicative of a tennis elbow problem. Now, the pain can radiate down into the forearm from this outer elbow area because it's coming down the muscle. It can even go up into your triceps. So we are not looking at the biceps as the inner arm. You're looking at more on the triceps because there is a covering on these muscles, which is known as a fascia, and it is continuous from these forearm extensor muscles here up to your triceps here. And sometimes it can even go into the neck and shoulder area. So that is all because of that continuous fascia. So that could be an area of pain. Now, Another typical feature of tennis elbow is when you make a fist. So, when you make a tight fist, or you bend your wrist and fingers down, or you do this rotatory action, when you're trying to open a doorknob, or if you're pouring water from a jug into a glass. So, this rotation action of your forearm, or this bending action, or if, say, I am squeezing something tightly in my fist, so I'm making a tight fist here. So all the muscles that are coming from here into my fingers, do you see how tightly they're stretched over my knuckles and my fingers? So when that muscle is stretched, you will have that pain going in any of these areas that I just described, either your forearm or your triceps or just localized to the elbow. Now, you can also have pain lifting any object in your affected arm as compared to your unaffected arm. So, basically, say if you're lifting a bag of groceries, a bottle of milk, or you're carrying your baby bag, you will find it more painful on the affected side. You may also notice, now, this is something that may not be in the first few days of tennis elbow, but maybe later down the line you might find that you have reduced grip strength on the affected side. So, for example, if I'm lifting a cup full of water with my affected arm, the grip strength in my affected side won't be as strong as my unaffected side. You may feel that some objects tend to slip out of your hands as well. So that has all got to do with your grip strength. So just looking at my notes here, yeah, there's another thing is you might find that you have stiffness in your elbow and forearm muscles. So basically this outer elbow and forearm area, you might get stiffness in this area, especially after periods of inactivity, like you've gone off to sleep and when you wake up you find that stiffness in your elbow, or when you wake up in the mornings you find the elbow is stiff. So these are very common symptoms of tennis elbow. So, this was a basic understanding that I wanted to give you about tennis elbow. Of course, there are many treatment options out there, starting from home remedies such as cold packs, hot packs, tennis elbow braces, shockwave therapy, dry needling, etc., etc. There's like lots and lots of them. And of course, physical therapy, that's a popular one, apart from medication, painkillers, and injections. Now, I have written a blog on the same topic, Understanding Tennis Elbow Causes and Symptoms. I will leave a link in the description if you're watching me on Instagram in real time. The link will be in my bio. If you can't find it, you can DM me and I'll send it to you. That blog has got some additional information on tennis elbow. I have left a video in there which talks about some tips that can help you to get the maximum use out of your tennis elbow brace. That was a video that I had done last time. In case you missed it, you can even go to my YouTube channel and have a look at it there. Also, in the blog, I talk about what are the causes of your elbow pain. If you have elbow pain and you're not sure if it is tennis elbow or a golfer's elbow or any other problem in that area, you can have a look at that free guide and it'll guide you through a step by step as to what could be the potential cause of your elbow pain. Alrighty, if you have any questions, any comments for me, do drop them below the video and I will address them for you.